you're watching this video, it's because you're gonna need some movement of your shoulder for starters. My name is Yvette Pasaret and I'm a physical therapist. We're gonna do some warm-up that includes movement of our shoulder, movement of our neck, and movement of our shoulder blades. So for a warm-up, we're gonna start with our neck, okay? We're gonna do 10 repetitions and 3 series, okay? So we're gonna go first down, middle waist, up, and we're gonna stop middle waist. This little stop is not necessary, but if you feel like it, you can do it, and if you don't, you can do it all continuously, but make sure to do it slow, okay? We're gonna do that for 10 times. Then we're gonna do rotations to our left, and to our right. We're gonna go right, little stop, left, little stop. 10 repetitions for 3 series. Next exercise, we're gonna do lateralizations, which means our ear is gonna try to reach our shoulder. We're gonna go right, middle waist, left, middle waist. That for 10 repetitions also, and we're gonna repeat 3 times again, okay? Then we're gonna do the movement of our shoulder blades. If we don't know what it are, it's this little bone right here, which includes our rotator cuff, okay? The muscles of our rotator cuff are right here. Shoulder is not just this, the shoulder is all this, okay? So that's why we have to move it, okay? Then we're gonna go up and down, up and down. All of the exercises are gonna be 10 repetitions and 3 series. If you have a lot of pain, you can reduce that to 8 repetitions, or you can reduce the number of the series. Like for example, I can do 1 of 10 repetitions if I have a lot of pain. But if I don't have a lot of pain and I can tolerate it, because this movement usually kind of gives us a little bit of pain. So we're gonna do it slow and at your tolerance, okay? So we're gonna go up and down, up and down 10 times. Later on, we're gonna do some rotations also. Our shoulders are gonna go to the back with small rotations, 10 repetitions. Then we're gonna go to the front with small rotations, okay? Then we're gonna do something that's called decoaptation. That movement is a little bit different or a little hard to get, so you have to watch it really closely. This is a neutral position of my shoulder, okay? So this neutral position to do the decoaptation, I'm gonna go down, as if my hand is trying to reach my knee, okay? But I did something wrong. I did like this, and my core shouldn't move. Just neutral position, and I'm gonna go down and relax, down and relax. Also, that one we're gonna do it 10 times, okay? Then the other shoulder, down, relax, 10 times, 3 series. After that, we're gonna do some exercises that are called Cosma exercises. Those exercises are done or actually usually prescribed by your doctor at the first weeks after the surgery. So this consists on pendular exercises. When we're doing this exercise, we're gonna fight ourselves to not force like this, or like this, or like this, or like this. We're gonna go in front and back with pendular exercises. I'm gonna explain it first, and then I'm gonna do it. For that, you will need a little table or a chair so that you can grab on and do these exercises. So we're gonna go to the front and to the back. We're gonna go lateral waist, and we're gonna go circular to one side and circular to the other side. Okay, now I'm gonna do it. I'm gonna grab the table with my other hand. This one, let's imagine that this is my shoulder that I had the operation or the surgery. So I have to be like this. I'm gonna place my foot one in front of the other to gain more stability. My back should be straight. And with the gravity, I'm gonna let my shoulder or my arm go down. Okay, like this. If I already have this, then I'm going to go to the front and to the back with my whole body, so that with that gravity and the inertia, my arm goes back and forth, okay? I'm gonna do that also 10 times. Or you can do it with a chronometer for 30 seconds each. Then we're gonna go to the sides, and for that I have to move my body to the sides to do some pendular exercises. Later on, we're gonna go circles clockwise and then circles counterclockwise. Okay? After I'm finished with that, we can do other exercises that are active and passive exercises. Those exercises, you should go to a bed or somewhere where you can lay on. Remember that this is my arm that had the surgery, and the arm that's gonna do all the exercise is gonna be my left hand, okay? So I'm gonna lay upside down. I'm gonna take my hand, okay? And I'm gonna lift my arm. During the first weeks, we shouldn't go farther on than this level. We're gonna go to a 90-degree level of elevation of my arm, and then I'm gonna go down and up and down, up and down. Other exercise that you might do is to pull like a chest pull. I'm gonna go up and down towards my chest, okay? That are some exercises that you can do for starters to initiate your movement of your shoulder, okay? And something you should avoid, unless your doctor says the contrary, you should ask your doctor for everything, but something that I actually recommend is to stop doing like this movement, the external rotation of your shoulder is also like this, or the internal rotation. For that, we have to wait several weeks, like about 6 or 8, to start doing those movements. But if your doctor says the contrary, you should do what your doctor says, okay? If he or she lets you do any exercise, move as you wish, you should do it that way, okay? So I'm gonna be here. See you next time.